Perhaps you could tell us, we tried this questioning before, but how many Canadians don't have a family physician?
Well, as I indicated before, it's difficult to get an exact number. There's between 12 and 14%, but again, it's difficult to know with precision.
Just the number, perhaps, Minister. How many?
Well, as I've indicated before, it's impossible to give an exact number. I'd say in a ballpark range would be between 12 to 14%.
Yeah. So are you telling Canadians out there that you, as the Minister of Health, really have no idea?
What I'm saying is that the health data, which is collected by provinces and territories, is not as clear as it should be. That what we get from provinces and territory leaves some ambiguity, and as a result, we are best left to speculate as to what that number would be.
Thanks very much, Minister. So it's really 6 to 7 million Canadians without access to primary care. 6 to 7 million. How many doctors will Canada be short by 2028? This is recent stuff. I don't know if you've read it, but it's important numbers. You could share that with Canadians.
Yeah, and I would say that, and I would posit to you, if you're going to advance deep cuts to the health system, then that number is going to grow exponentially. It's incredibly important not to allow cuts to occur to our health system. We've signed. Thanks,
Minister. I didn't say anything about cuts. I asked you for a number. How many doctors will we be short in this country by 2028?
I'm not going to engage in a hypothetical. I think that trying to guess what that number might be, I imagine that you have.
So once again, you have no clue. That's
no,
what you're telling
I would say, Mr. Chair, I'm not here to play Jeopardy with you. If you have these questions where you have an answer,
no idea.
No, because frankly, it depends upon what happens in the next election, Mr. Chairman.
44,000. So
no, but that's
what
a
your government has done
number.
is increase taxes on health care. The capital gains changes. Comes into force next week. How many more Canadians will be without a family doctor based on these changes?
Having a more fair and balanced tax system where doctors still have...
I didn't ask you about taxes. I asked you how many more, and maybe you're having trouble hearing, but I can say it again for you. I'll say it slower. How many Canadians, because of your tax changes, will be without a physician?
I would say that the menace to our health system is the cuts that you would propose to it. It is not a more fair and equitable tax system that asks those who make the very most to pay a little bit more so that we can have a safe and secure health system.
Just the number,
if you want the opportunity,
how many more Canadians will be without a physician because of your tax increases? How many?
I reject the premise of that question. I think that what is a menace to our health system is the cuts that you would impose to that system. That a doctor still has huge advantages under our tax system
so as
to be
we
able
said,
to
Minister,
use
right now,
incorporation as a tax deferral
6
vehicle.
million Canadians don't have access to primary care. How many more, when you increase taxes, will not have access to a family physician? These are not hard questions.
Well, they are because they're not rooted in reality. Look, you have some bizarre thing you're doing. I don't know what you're doing. I'm trying to answer rooted in reality. The reality of our health workforce crisis is the investments that we're making to both accelerate foreign credentials and other forms of credentials, and to make sure that. And to make sure in the other instances, well, you're not interested in an answer.
Estimates would say by 20, I'll say it slower for you, because you're struggling, I get it. Estimates would say that the doctor shortage will be 44,000 by 2028.
I reject that. I think the work that we're doing...
Excuse me, Minister, I'm not finished. Just listen. I know it's hard. How much worse will the shortage get when the tax changes take effect? Simple question.
I reject the premise of that question. I don't think it's true or accurate. And I can walk through the tax advantages that continue to remain for doctors, which are very significant, and that the asking for a more just tax system is not the menace to our healthcare system. Your cuts, sir, are. The cuts that you wish to impose upon our healthcare system are a clear and present threat to us not being able to ensure that people have the healthcare work that they need.
Minister, the fascinating thing is you keep talking about cuts, but what I keep talking about is the tax changes, the tax hikes that you are promoting for healthcare. Did your government complete an analysis on the tax hikes before implementing the change?
So asking those who are making more than $250,000 from capital gains.
No, that's not what I asked you. I said,
I don't agree. Look, I'm not here to play your bizarre game. I'm here to try to answer questions rooted in reality. If you want to issue a press release with your thoughts,
Canadians not having a physician is a game, then you're in the wrong job.
I think
you are in the wrong job.
I think cutting dental care, cutting pharma care, cuts to health care. So I guess
the question is, Minister,
those are the things that are menacing our health care system, asking for a more equitable tax system.
Are you really going to just never answer any questions? Is that your plan? But the question really is, did your government complete an analysis on the tax increases before you implemented the change? Yes or no?
I think the analysis of the tax changes demonstrate very clearly that we're asking those who have made an extraordinary amount of money through capital gains and had an incredible last 5 years to pay a little bit more,
Minister,
so that a nurse
question
isn't
is-
paying a higher marginal tax rate
Minister,
than
the
somebody
question
else.
is, did you complete an analysis? Did your government complete an analysis on the tax change? Yes or no?
And I've
And if you
answered that question. There is absolutely an
If-
analysis
Chair?
done to
Did-
make sure
did
that
you-
this is
Point of
more
order?
equitable and more
If you
fair.
did, then
point of
please
order,
table
Mr.
it with
Chair.
the committee.
I have a
I'd
point
love
of
to see
order.
it.
I have a point
Chair,
of order from
I'm
Ms.
calling for a
Kayabaga. Go
point of
ahead.
order. Thank you so much. First, I just want to say that I could barely hear folks in the room. If they could increase the sound would be great. My sound is pretty high. I'm calling a point of order because the minister is here to answer questions. Like if he is asking me
Here's a
questions,
liberal
like,
defending a
to answer
liberal.
questions and not speak over him. It's really hard to even hear what they're saying when they're speaking over each other like that. So if he's asking a question, I would say that it would be great for us to hear the answer as well.
Yeah, well, he doesn't get to just babble.